So this is a good question, an anatomical question. Beside the biceps tendon, which of the following structures also pass through the rotator interval? The choices are the coracohumeral ligament only, the coraco and superior glenohumeral ligaments, the coracohumeral superior and middle glenohumeral ligaments, the superior and middle glenohumeral ligaments, and then the superior glenohumeral ligaments alone. The correct answer is the coracohumeral and the superior glenohumeral ligaments. So this is a good fundamental anatomy question talking about the interval. The interval is the tissue between lateral to the coracoid process, superior to the subscapularis, and inferior to the supraspinatus. And it is bounded by, it is formed by ligamentous contributions of the middle glenohumeral, I'm sorry, the superior glenohumeral ligament, the coracohumeral ligament, etc. So it's running within that tissue is the biceps tendon as well. So just to review, the glenohumeral ligament soft tissue stabilizers are divided into static restraints and dynamic restraints. The static restraints are the glenohumeral ligaments, which we'll hear more about in the next webinar, the labrum, and the articular congruity, as well as the negative intra-articular pressure. The dynamic restraints, which we're going to talk more about today, are specifically related to the rotator cuff muscles, the long head of the biceps, and the important periscapular muscles. The rotator cuff muscles are really helpful by augmenting that concavity compression phenomenon. So the rotator cuff muscles actually give you a good mid-arc stability, whereas the ligaments usually are more important for stabilizing at the ends, at the end range of movement. Rotator intervals involved in various pathologic states. Contractures of the interval is classically seen with frozen shoulder. That's a very good test question. Laxity of the rotator interval results in is a part of multidirectional instability, and it usually manifests as increased inferior translation or a sulcus sign. Again, the boundaries of the rotator interval are the coracoid base medially, the anterior edge of the supraspinatus superiorly, and the superior edge of the subscapularis anteriorly, and those things apex together laterally and coalesce and form the anterior cable attachment and the transverse humeral ligament. The long head of the biceps does act a little bit as a humeral head depressor. It's not as in vogue now as much to think about the importance of the biceps in terms of normal shoulder dynamics, but it has been shown to contribute to head depressor activity and also to control derotation of the shoulder in overhead athletes. The attachment of the biceps to the superior labrum is a known weak link, and it's a little bit weaker with eccentric type contractions, which we'll talk a little bit about more later, so that later phase of throwing can sometimes result in traction injury and slap tears. It's important to remember that the biceps tendon is stabilized by fibers of the rotator interval, specifically the upper subscapularis tendon, the superior glenohumeral ligament, and the coracohumeral ligaments. So you should think about bicep instability potentially with subscapularis tendon ruptures.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.